So I guess there's two of you. Um, so thanks for coming. It's just the three of us.
Oh, this is it?
I guess so.
It's a little bit late in the day.
I was like, I'm not really, why did they put like a wellness talk at 5 p.m.? You know, or any kind of talk
It's on
at
brand.
at 5 p.m. So I guess we'll just kind of casually sort of do this.
That's cool.
Yeah? Unfortunately, I'm stuck up here because I think the guy before us took the clicker. So I'm chained to the computer. Otherwise, I would love to be closer to you. So since there's just the two of you, I'm incredibly interested to know what made you want to come to this talk.
My daughter is having some anxiety problems. I think a lot of medical students, residents, and faculty. I just came from the stigma thing about mental health downstairs and to 11. So I'm not seeing one myself, but I was curious for the title. And I get
Dig it.
an hour to kill before 6 o'clock.
All
so
right, I
figured
dig it.
would,
Okay,
just come in, just hear what you had to say.
perfect. All right, thanks. Yeah.
Similarly, it's something a lot of people in our field deal with.
Yeah.
And I want to be more well equipped on discussing it.
Yeah.
um,
Awesome.
with others.
Cool. So my name's Nicole Battaglioli. I'm an ER doc in Atlanta. I have no disclosures. And so I'm a mom, I'm a wife, I'm a doc, but I'm also an individual that has had issues with things like postpartum depression, anxiety, and especially over the last few years, most recently PTSD was some of the things that I would see in the department that I worked in. And we're not alone in this. So if you look at rates of anxiety, depression, and PTSD, 20.9% of physicians suffer from that when you compare it to roughly 11% of the general population, right? And those are the stats for depression and PTSD as well. We're at the top of the list typically when it comes to those affected. All of those specialties, kind of high trauma, sick people, death and dying, you know, we're in good company, right? But this is not uncommon, right? And what are we potentially exposed to at work? Burnout, which we've heard tons and tons about over the last couple of years, right? Everybody's talking about burnout. We can be subjected to second victim syndrome, which is where you kind of take on some of the trauma that you see. Maybe you weren't in the car accident, but you were deeply affected by taking care of that patient who was severely injured in a car accident. You kind of take that home with you. And more, we're subjected to possible acts of physical and verbal violence in the department. I gave this talk a couple of weeks ago to a women physician wellness conference. And while I was flying to that conference, that was the day that they had the shooter in the hospital in Atlanta that, you know, shot like 4 or 5 people in one of the medical hospitals in downtown Atlanta. So we're exposed to these things. So what if you tell me, no, my job's great. I don't deal with any of this. This is all great. If we look back to how we came into medicine, we didn't really get here by being super mentally flexible and by being able to adapt super well to different things, right? We're rewarded when we have kind of compulsive coping mechanisms, right? We got straight A's, we took tests, we stayed up all night taking care of patients, we went through residency, et cetera. Right? So the process of physician training actually rewards things like rigidity, strict adherence to rules, all of these things. And at the very bottom, it also kind of programs in a very pervasive feeling of often self-doubt, right? Did I do the right thing? Did I make a mistake? All those things. So even just the process of going through medical school and getting to where we are in of itself doesn't really lend itself to being very mentally flexible and ability to take care of our mental health. Are y'all familiar with what the ACEs are, the adverse childhood experiences? Yeah. So this came out of a study, a 1994 study that was done with the CDC and Kaiser Permanente, where they looked at a bunch of people and if they had exposure to certain incredibly disruptive or neglectful or abusive situations in their home. So they looked, they're all kind of listed there, and if you think about it, that list doesn't even include things like living through a pandemic, natural disasters, or world conflict. And one of the interesting parts of the study is that when they looked at the ACEs and children that had been exposed to those things, they were at increased risk to even suffer from things like heart disease, cancer, and obviously put them at higher risk for suffering from things like mental health issues, et cetera, right? So if you had between 1 and 3 of those events, which they're really common, they're incredibly common in that study, they found that over 60% of children had at least one ACE, right? So they're incredibly common. If you have between 1 to 3, it increases the risk that, again, you might be alcoholic, have heart disease, and 1 in 10 has attempted suicide. So the general population, I'll say general population, non-ACE stats are in the parentheses. So if you compare your risk of developing heart disease, it's 1 in 7 when you compare to people who've not experienced any ACEs 114. And what can also be incredibly frightening is if you've experienced 4 or more, it showed that 1 out of 5 of those individuals had at one point attempted suicide. So even when we come to the table, and if you are just thinking about, well, yeah, I do have a tough job, think about the things maybe it took for you to get to this very tough job. You might already be bringing baggage to the table that's gone unprocessed for years and years that actually can increase your risk of having very poor health outcomes that you would think are not related whatsoever. So the purpose of the talk, or the title of the talk, is, well, what am I supposed to do about that? How do you want me to process these things? And that's find a therapist. I have a great therapist. Her name's Peggy. I love her. We've been meeting for over 2 years, and she's helped me make incredible gains in terms of like my ability to deal with work stress, all kinds of stuff, right? So, but how do you find one? You can consider a few different things. You might want to think about perhaps what kind of, therapy you might want. Cognitive behavioral therapy is one that we're super familiar with. But there are other things like maybe family therapy, trauma-informed therapy. So if someone's got a very significantly traumatic past, you might kind of seek more trauma-informed therapy. Consider your personal preferences. Do you prefer working with a man or a woman, someone that believes in your belief system? Think about what preferences might make you kind of click with that person a little bit better. And don't be afraid to ask, for recommendations from friends or family or your doctor or, whoever. You can put it under the guise of, I have a patient and I'd really, love a therapist to refer them to. You know anybody good? And then just, use it for yourself. The biggest thing, though, is don't be afraid to try somebody out. And if you don't click, you can move along. It doesn't necessarily mean that therapy is not for you, just that particular therapeutic relationship might not be for you. The number one predictor of whether or not therapy will be successful for you is if you like your therapist. It doesn't matter their level of training. It doesn't matter particularly what kind of therapy is, if it's cognitive behavioral therapy or something else. It's whether or not you get along with your therapist and you like them. Number one predictor. So we'll kind of get into like some of the barriers, which is where a little bit of the like kind of fact meat is, right? Because there are barriers, right? There's a lot of stigma. In one study looking at medical students, 3rd and 4th year medical students, it showed that over 50% of them within the previous 6 months felt that they had met kind of a classification for depression, And when asked, the majority of them didn't want to seek out any help or didn't want to talk to anybody because they were concerned about the stigma, right? It's still there. But if you look around and you ask people, there's no person on this earth that has not seen some shit or has not had to deal with something, right? And it's super common, so why don't we talk about it? Then there's the issue with, what about licensing? I'm not sure where you are in your path.
I'm a resident.
Okay. I'm sure you know when you're filling out your licensing forms, many states ask pesky little questions that sometimes get into, have you ever had a mental health issue? Have you ever undergone treatment, etc.? We'll talk about this getting a little bit better, but this is a big barrier for a lot of people. Might cause somebody to pay cash to see their therapist so they don't use their insurance, use telehealth instead of driving to an office, driving out of state to get help, because people are concerned that they will have to report this on their licensing application and that they may be forced to undergo a treatment program that might be similar to that needed for drugs and or alcohol. So to try to combat this over the last number of years, they are trying to make changes and recommendations. In 2019, the Federation of State Medical Boards made 4 recommendations that said states should really only ask about something if it causes impairment. And according to the AMA, impairment means that you are unable to do your job with moderate safety and skill, right? How many of us have stayed up for 24 hours and we can still do our job with moderate safety and skill, right? So just because there's illness doesn't mean there's impairment. They recommended that they only ask if the condition is current, so within the last 2 years, whereas some states would ask about your lifetime history of things that are really just not pertinent at all. To have an option for a SITS, was safe haven non-reporting, but if you are already in a treatment program, that you don't have to check yes on the box, and that they use supportive language that's supposed to kind of make you feel like they're supporting mental health, whatever that means. So that was in 2019, and 2 years later they did a study where they looked at each of those states and gave them a point for each of those 4 recommendations, how friendly their licensing wording is. This is not super up to date in a sense that some states have really made some gains in the last couple of years changing their verbiage. But you can see there's some states that are not so friendly and some states that were. Where are y'all from?
I'm in Virginia.
Virginia?
Pennsylvania.
Pennsylvania, yeah. So, and this, it's a huge deal. Another study of 2,000 female physicians, half of them indicated that they felt like they had suffered from a psychiatric disease. And again, the majority of them reported that they didn't want to get help for fear of licensure issues. So even outside of the recommendations from the Federation State Medical Board, there's also an argument to be made that some of this questioning is actually illegal and goes against the American with Disabilities Act. Do you guys know which psychiatric conditions are covered by the ADA? So
All of
you,
it?
pretty much, right? So the big one, bipolar, schizophrenia, etc. But anxiety, depression, and PTSD are entities covered under the Americans with Disabilities Act, which means that your job and also other state and local governing boards, like a state medical licensing board, should not really be asking questions that could potentially discriminate against you due to a health condition that you have. You don't ask the diabetic, what's the lowest your blood sugar's ever gotten? You could be hypoglycemic in the department. We don't ask about that. So there's an argument to be made there. And there actually was, in 2017, a case with the Louisiana State Supreme Court where the Louisiana State Supreme Court decided that, yes, the verbiage on their licensure applications for both physicians and lawyers was against the ADA standards and made them take the language out and change it. So there's an argument to be made there. But a lot of times, people have concerns about, what about my employer, my job? Will I be treated differently? Will they look at me differently? Unfortunately, maybe, right? But the fact is, they're not really allowed to discriminate against you for having any sort of kind of mental health issue that you're working with. Especially if you compare that to like all the other medical conditions that we don't discriminate
And
against.
so that map you showed, so the high number is bad,
The higher the better.
or the higher the better.
Yeah, so they gave a point for each one where they were abiding by one of the 4 recommendations. So it was the higher the better on that one.
Can you go back?
Do you want me to go back?
Please?
Yeah.
What were the 4 recommendations again?
So to ask only if it was impairment and not just illness. So the language would be, are you have you ever been or are you currently impaired by substance abuse, mental health, or psychiatric disease, et cetera? Only asking about current issues, so within the last 2 years.
So if you didn't ask, it's good.
Right,
Point.
right. And so states that didn't, there were some states that really didn't ask about, they asked about medical conditions, but not psychiatric conditions, and they would get essentially 3 to 4 points depending on the language of their verbiage. So how would you answer, if you're filling out these applications and, I'm not a lawyer, I can't give you legal advice. You can always ask a lawyer. If you choose to work with a therapist, and this is something I tell people if it's really concerning for them, you can ask that potential therapist how they deal with things when they are requisited for documentation. So Peggy, my therapist Peggy, she also works in forensics, and so she's very familiar with the court systems and legal systems. And I asked her in prep for this talk, what do you have to give them? Like what do you say? What do you do if somebody comes to you and either, in terms of like FMLA paperwork or state board, or the other issue is that maybe it's not your state board, but your hospital, on your hospital credentialing paperwork asks some of these questions, which we find is still an incredibly pervasive issue. And she's like, I don't tell them anything. I tell them that, yes, I see you as a patient, you're not impaired, and as far as I am concerned, you can work.
But you're still reporting that you're currently in treatment and with her as a reference, and then they contact her?
Because another paper that I didn't put up in here is they did a study, or they looked where they actually contacted each state medical board and asked them, like, okay, well, when somebody answers yes, like, what do you do? What was astounding is like 60% of them, like the representatives from the board, they're like, I don't know. I don't think we do anything. There are some boards, though, that will, like, I can't remember which state, Mississippi, where they will say, if you click yes, then we're going to need the name of your treating provider for the last X number of years. And then you essentially have to give consent for them to reach out to that person. And she's like, this is what I tell them. If someone reaches out to me, and if they want more, they can take me to court and subpoena me. In which case, then I'll do whatever I have to do. But she's like, I've never had it go that far. So, maybe it's a conversation that you have with a potential therapy match of like, how do you even know as the therapist, like how you would address this? Because this is a big concern for me, of like what would happen. And then the last bit is just kind of in the realm of advocacy. So there's been a ton of advocacy that we've been trying to do. I'm a part of this subcommittee with the Institutes for Healthcare Improvement, the IHI, and it's called the Healthcare Heals Coalition. And so working on lobbying, meeting with legislators, et cetera, to kind of change language. If this is something where you're like, I noticed that on our hospital credentialing forms, you ask these questions and they really shouldn't be there. If you go to the IHI Healthcare Heals Coalition, we have some slides that you can use. There's a templated letter that you can use to like send if you ever kind of feel like you want to do a tiny bit of advocacy. And then last slide is, it is actually working. So this is an update from just this past February where, again, I said I'm in Atlanta, the Georgia Composite Medical Board actually finally changed their language, which used to be, they used to ask, have you ever had a, mental health condition, ... And they finally changed it to, are you currently suffering from any condition for which you are not being appropriately treated that impairs your judgment or would otherwise adversely affect your ability to practice medicine in a competent, ethical, and professional manner. So a little bit of light at the tunnel, perhaps. It is kind of slowly changing, but there's still a fair bit of work to go. So that's all I got for you.
Thank you.
Questions, concerns, comments? Yeah. Thanks for coming.
It was informative.
Good. Okay. Perfect.
Appreciate you doing that.
Yeah.
Yeah, thanks.
Yeah.